Tomorrow marks the 18th National Black HIV/AIDS Awareness Day. According to data from the AIDSview Project, the number of people in Houston diagnosed with HIV is twice the national average, and more than half of them are minorities. Tomorrow, the University of Houston is hosting a panel discussion on this epidemic and how to end it. Here to tell us more are Samira Ali, an assistant professor at U of H's Graduate College of Social Work, and Vanita Ray, public policy manager for Legacy Community Health. Ladies, thank you so much for being here this morning.
Thank you.
Samira, I want to start with you. Talk to us a little bit about the Gilead Compass initiative that U of H is involved in.
Absolutely. So reiterating what you just said, HIV rates in the southern part of the United States have started to rise as opposed to nationally where they've started to decline. And because of this need, the Gilead Compass initiative in partnership with the Graduate College of Social Work, we're starting a center on mental health, trauma-informed care, substance use, and wellness to address the need in the South.
Vanita, you tell us you were diagnosed with HIV back in 2003. Walk us through the steps that led you to become an HIV activist.
Well, sure. I've always been an activist, well, I'll say an advocate. I was an attorney in D.C., the height of my career, and was diagnosed with HIV in 2003. Had a difficult time coming to acceptance of it because of the stigma attached to it, and came to Houston to kind of lay back and got involved in advocacy as a way to reclaim my power, find my voice. And here I am 7 or 8 years later after going through a dark period, and it just became the way that I began to kind of come back again. And so it allowed me to reclaim my power, and I got involved. And about 2 years ago, we began an initiative here in Houston called End HIV Houston, where we're trying to cut the epidemic in Houston and end it. And we got involved with U of H as a result of that, working in the community to end the epidemic. So it's become a personal and a professional mission for me now.
And there is such a need to help those who've been impacted by HIV and AIDS in our community. Talk to us about some of the resources that are available to community organizations that deal with HIV and AIDS.
Absolutely. So as a result of the Compass coordinating centers, we'll be able to work with communities to better understand their needs and work with them to also develop solutions. And a part of that solution is to be able to provide small grants to community-based organizations to build their capacity, to further enhance their training around mental health, around trauma-informed care and substance use.
Well, ladies, thank you both so much for being here and for raising awareness and for the work that you're doing for the community. Appreciate it. The panel discussion on HIV/AIDS in Texas and the southern U.S. will take place tomorrow morning from 10 until 11. That's at the Hilton University of Houston, the Waldorf Room on University Drive. We're going to post this interview for you on our website, click2houston.com.